Should I just keep going?
Come on then.
Is that okay?
Is this still rolling?
Yeah.
Oh. Sorry, Jake. Sorry, I forgot already.
You are going to edit this stupidness, aren't you?
Not just going to have the whole video in there.
Hello, I'm Mark. I'm Managing Director of Heritage Healthcare Trafford, and I'm very, very proud to be Managing Director of such a great team. The driver for me setting up the business was the fact that shortly after my father died in 2014, my mother developed Alzheimer's. As families know, supporting people with Alzheimer's is very, very difficult. It wasn't helped by the poor care that she received either. So this gave me an idea. So when I was made redundant, I took a year out and I researched the market and decided that together with Michael, my son, my eldest son, we would set up Heritage Healthcare Trafford. So when we set the business up, our prime aim was to be the best care company of all the 80 providers in the whole of Trafford. We decided that we'd have a culture that put the clients and the carers and all the staff at the forefront of everything we do.
My name's Michael, I'm the Operations Director here at Heritage. So I've been here from day one. It's ingrained that the clients are at the heart of everything we do. So it can be small details such as we make sure every client has a birthday cake and a card on their birthday. Every member of staff gets a big bouquet of flowers on their birthday to make sure that they feel like they're valued.
My name's Julie and I've worked for Heritage for the past 8 months. I used to work in pharmacy and I decided that because I dealt with a lot of people that came into the pharmacy, that a lot of people in the community needed probably a little bit more help. My father had dementia and I looked after him for a while, and I thought that I needed perhaps a change in my job role and felt I wanted to do something a little bit different.
My name's Shirley. I've been working for Heritage for just my second week. The first week was shadowing, this week is the real thing. Yeah, I chose Heritage because I've sort of through word of mouth and people that have worked here have told me how good it is to work for, so I thought why not give it a go.
Hi, I'm Emma. I'm the care supervisor for Heritage Healthcare. I work alongside Wendy's care manager and I've been here for about a year now. I chose to be a healthcare assistant because it's really rewarding. Even though it's challenging at times to be in the situation that you're in, it is really, really rewarding and you feel like you are helping.
I'm Samantha Calso. I'm a sport worker and I've been here for about 16 months. I chose to be a healthcare assistant because I heard good things about this company in particular, and they're very family orientated.
The benefits of working here are that we always look to promote somebody from within our ranks. We do that because when our carers come on, they go through an induction program, which includes time spent talking about our culture and our values and what good behaviour looks like.
So my name's Alex Colley, I'm the HR Director for Heritage Healthcare Trafford. I'm responsible for bringing on new employees, making sure they go through their training, and then also looking at our retention strategies as well, making sure our current employees are all happy. I joined the company to look after the recruitment, as we do feel it is important that when we onboard new staff that they're right for our values and our culture, and we're also right for them.
I'm Rachel, I'm a healthcare assistant and I've been here for about 3 months. Well, at the beginning you start off shadowing, so I followed another employee for a week, shadowing them and learning their ropes, and since then I've been put on my own and things like that, so I've gained more confidence and I've met quite a lot of the clients and things like that, and obviously not doing any work like this before in the past, I think I've gained quite a lot of new skills.
We covered a lot of different areas from CPR, obviously moving and handling, hoists.
I've had to learn how to pick up a wheelchair, how to even put one out. It's simple as things like that are quite daunting for some people.
Yes, my role has changed quite a lot while I've been here at Heritage. At first I started as a carer and was doing full-time as carer, and now I work closely with Wendy on all the assessments and managing the staff.
The carers receive a competitive rate of pay We have plans in place if we hit budgets to escalate the pay as quickly as we can. After a year, they can become part of the car scheme that we operate. So they get subsistence towards a company car. They receive a pension. They receive mileage. We have an open door policy here, which means that a carer doesn't need to make an appointment to come in to see the management team. If they want to, they can come in, have a cup of coffee with us and talk to us about any concerns or any issues, or indeed anything.
But it works really well. The carers feel valued, they feel like they can come in, issues don't fester.
So not only are we on call 24/7 in case any emergencies happen, we're always there in case the girls need us. We have Jane, our quality assurance officer, who's constantly out doing spot checks and supervisions, making sure all the staff are happy.
And it allows us to keep ahead of the game as well, in terms of we can spot issues that might be coming up on the horizon. We can find out about changes, in people's behaviours, people's personalities, and things like that. So, the open door policy is certainly one of the better policies in terms of us learning about our clients and us learning about our staff as well.
My name's Jane McMahon. I am 36 years old. I have worked with the company for just over 2 years. The management team is very supportive of all the staff, of each other really. Any queries, problems, it gets dealt with straight away.
Hi, I'm Wendy. I'm the care manager. I've been working at Heritage Healthcare since December 2015. The support is ongoing. It really is 24/7, and I think you'll find from all the staff we're really, really supportive as a team. Not just me and Emma, the whole of the office, all of us are supportive. And the nice thing about it is that the staff actually support each other. That's also we are a big team.
My name's April. I've been with Heritage for I think it's about 15 months now. I'm not just saying it because I work for Heritage, but it's probably the best management I've ever worked under. They don't care what problems you have. You can ring them anytime. They'll sort you out. And any problems, they're right behind you with anything. I can honestly say it's a great support network that they have in here, all of them.
There is a family atmosphere. There's an open door policy. There's not really a big divide between the staff and the management.
Do you know what it's
No, I don't.
You're right, okay.
I'm struggling as it is.
Right.
Get up. That's how much of a family we are.
To me, an ideal carer is compassionate, has really good time management skills, is organised, is a good communicator, is understanding, is patient, sees the bigger picture, understands the individual client and their actual needs, and works to a manner that satisfies that client's needs. And someone who has a really good disposition, who's friendly and smiles and has a really positive attitude.
In terms of a potential employee, it's a difficult one sometimes. Actually, some of our best carers have never done care before. So one of our best ones, who's been promoted from within, sold wedding dresses before coming to work for us.
Here at Heritage Healthcare, we are looking for people who are genuinely caring, people who are reliable and trustworthy, and are very compassionate people who are willing to make an impact in the community.
My name's Jade and I work for Heritage Healthcare. If I could change anything about the job, it'd be the time we get to spend with the clients, because some of the clients you feel like you could spend a lot more time with them.
My name's Sharon. I've been here 4 months and I'm a support worker. If there's one thing I could change about the job, it'd probably be the driving. I really don't like driving, but it's part of the job.
I don't know what I would change. I don't know. I don't think I can answer that question.
If I could change one thing about the job, to not have as much feelings.
If I could change one thing, it would probably be that it was less paperwork, because I do quite a lot of that and it's tedious, but hopefully we're going to change that with the new system that we're looking at, so it should be good when it's implemented.
The weather, probably.
If I was to change one thing about the job, I think I'd change our head office location. because the options at lunchtime just aren't really that great.
Best part of the job for me is actually making a difference to somebody, encouraging them and giving them that support that they hadn't probably thought about originally, but once we're actually in there with the package, they're really, really grateful to us. It is very rewarding.
So my favourite part of the job is seeing someone come on who's never done it before, and seeing them grow and transform into an absolutely amazing carer.
I get a great satisfaction from being able to get a nice bond with each client that I deal with, being able to achieve different things that they haven't done and we can do together.
My name's Jill Tomlinson. I've been with Heritage coming 7 months. I've met a lot of nice people and some have become, friends more than clients.
My favourite part of the job is to actually go and see the clients, to get the opportunity to go and see the clients. We're really, really busy here in the office, so sometimes that doesn't happen as much as we might like. But to go along and see them, to make sure that they've got a cake and a card on their birthday and things like that, really hits home why you do what you do. It justifies the long hours and it makes it kind of worthwhile.
I enjoy it because they're being able to stay in their own homes.
My name is Wahid Amini. I'm working for Heritage as a healthcare assistant. My favorite part of job really when I see the client or elder people happy.
My favourite part of the job is all the clients. Go and see them, each of them are individual. Can all have a laugh with them about different things. Some of them are cheeky, some of them are serious. But that's what makes them them.
We chose Heritage because I was talking to somebody and they said, well, if you're going to have one, get Heritage because they're the best.
We employed 2 different carers and they were really very poor. And then we got Heritage. Mark and Wendy came to look at us and we looked at them and they were just a different thing altogether. And they've been absolutely brilliant. We've been with them a year in February.
They're nice people. They are lovely people.
And the girls themselves are absolutely lovely. I haven't one that I wouldn't welcome back. Now that's very extraordinary to me.
It's everything. They come. When they do what they do properly.
Well, I have a shower, which I couldn't do on my own, and I'm not steady on my feet. My legs are poor, and she is very watchful as to how I'm going to manage to walk there, and then helps me dress. And I come through here and there's a cup of coffee waiting for me, and she then does breakfast.
Blackpool one was a trip. We were Kath then, and I was dancing in the ballroom.
And we had a very good lunch. That was the fish and chips, very good. And then we were walked all the way along the promenade, breathing in the sea air, and then we finished up in the Tower Ballroom, which was a lovely way to go really, because there was the organist and the music and beautiful dancing going on.
Mark's weekly email. Oh, I don't think we've got all day.
The weekly email is an email that I send out to all the carers and all the management on a Friday.
It has received cult status. It might go viral. Who knows?
I absolutely love it. It really does. It makes my week.
Within the email, it's quite informative. There's normally some information about clients in there. There's also some information about some of the new staff that we've taken on board that week and some of the training that's also going on.
But it's good as well because there's some clients that you don't see all the time, like there's ones I haven't seen in months, and then you hear just little updates that Mark puts in the emails that you wouldn't hear otherwise. So yeah, I think you should definitely keep the emails up.
Yeah, it's informative. It's all the carers really like it. I like it myself. It's got good, bad. It's got lots of useful information in it, and he always has, a laugh at the end of it. And the good thing about it is he always tells the staff that they are the best, because he truly believes that the staff are the best.
It can be constructively critical, but it can be very jovial as well. We like to have fun in this business. We work hard and we have fun as well, and it's important that the carers have fun and enjoy the job and enjoy the company.
Normally towards the bottom of the email, some trivial stuff about Manchester United. If you've ever seen Mark's office, there's lots of United shirts. I think the Cantona one's definitely my favourite.
I do enjoy Mark's weekly, it's pretty funny. Some of the stuff he puts in it. Don't agree with his football choices, but yeah.
That's it really. Heritage is the way to go.
If you're a carer looking to join the team or a client wishing to come on board, we look forward to welcoming you to the Heritage family.